Good Monday morning, you all. Um, Feels like fall outside. It's like 66 degrees. So it's a very nice, almost fall feeling day here in Boonville. So good morning. It's Monday, August 4th, right? August 3rd. Sorry, it's August 3rd. Okay, so I've had this up, this review up on my computer for probably 2 months. And with all the other things that we've talked about, I've kind of neglected to get to this one because it was kind of fascinating to read, actually. And I get asked this a lot, questioned a lot by men who are on testosterone or don't want to take testosterone. They're wondering if there's a way that they can naturally improve their testosterone levels. Hey, Wendy. Hey, Linda. Boy, it does feel like fall here in Boonville. This is the weirdest weather. It's been raining, and then this morning I went out on the porch and it felt like October, pretty much. So anyway, these guys are, I hear from guys all the time that, well, I don't want to have the expense of testosterone and have to be monitored and have blood tests and all that. And so they'll ask about these testosterone boosters, and it really depends on what's in them. So there's a myriad of sexual enhancement products that you can buy at Supplement Superstore, Walmart, Amazon, etc. So there's all kinds of different things. They have, of course, their little trade names and their little product names that are sometimes kind of funny. But the question is what's in them. So I'm going to run through some herbals that have been scientifically studied both in animals and humans. And I apologize, first of all, because even though I'm not technically from the Ozarks, I talk like I'm from the Ozarks, so my Missouri slur is always there. And when I lived in southwest Missouri, it really came out. I lived in Nebraska for a while. Nebraska has no accent, and I kind of lost my Missouri accent. But it's back full steam, even though I lived 10 years or so and 13 years in Oklahoma. But a lot of these terms are Latin, and I'm going to trip over them and probably say them wrong. And so if somebody has a Latin background, sorry for my slur. Also, I'm going to go through these, and you're either going to write them down. Wendy probably will, but I will put a list of them up in the comments later on, and then there are a few, of course, products from Life Extension that have them in there that aren't, advertised as, male potency. Some of these actually work in women as well, but most of what I get asked about is male enhancement. Women sometimes. I told you the story about using Viagra when it came out in the 1990s in women who wanted to try it, and sure enough, it works off-label. That's one of my FDA off-label things I did. So what's the deal? So for millennia, people have looked for aphrodisiacs based in nature. So procreation is an important moral and religious issue, right? So aphrodisiacs have been searched out to ensure both male and female potency. And so sexual dysfunction, there's a disorder that you can get that you can diagnose somebody with, female sexual arousal disorder. There was a medication that came out a few years ago. I wrote about it. Worked about half the time. So some of these little herbal things work better than that, and some of them are FDA approved. So yohimbe, for instance, is a natural substance. Why the FDA approved something that was nature-based, I'm not sure. Although, digitalis is from the periwinkle plant, and aspirin is from a plant, so those are FDA approved. But so sexual dysfunction can be inability to achieve normal sexual intercourse. That includes premature ejaculation, retrograde ejaculation, inhibited ejaculation. They always talked about erectile dysfunction. However, there's also reduction in libido or sex drive or arousal difficulties, and then compulsive sexual behavior, orgasmic disorder, and failure of the the penis to lose erection. That's one of the things that Viagra and Cialis, and I never think of the other one, Levitra, talk about. If you have an erection for 4 hours or longer, you should go to the emergency room. There's a way to reverse that, but you got to get in and get it taken care of. I know 2 men that didn't do that, and they lost function of the penis forever. So Viagra really, started out as a cardiac medication. They figured out that these guys were getting erections, and so they switched course and put it on the market for medical treatment for erectile dysfunction. That was in the 1990s. Heavy public attention, heavy advertising. Used to be, $27 to $30 a pill. It's now generic. You can get it for $13. You can get it compounded for $10 a pill. And so the search for an aphrodisiac dates back way far in history. So an aphrodisiac is defined as an agent or a food or a drug that arouses sexual desire. Okay, so the hunt for a natural supplement from medicinal plants continues to be looked at all these years later. And of course, now we have a way to pharmacologically test some of these, sometimes in humans, sometimes in animals, sometimes both. So it is any food or drug that arouses sexual instinct and arouses desire, increases pleasure, increases performance. Of course, aphrodisiac is from Aphrodite, the Greek goddess of love. And sometimes these are derived from plants or animals or minerals. So a lot of natural substances historically have been known as aphrodisiacs in Africa and Europe. So there's yohimbine, the mandrake plant, ground rhinoceros horn, that's in Chinese culture, and then you've probably heard of Spanish fly, which has been used for a long time. Unfortunately, Spanish fly is technically toxic. There was a list of foods I put on there, avocados being one, oysters, chocolate, coffee, honey, strawberries. The oysters have to be raw, supposedly, and those get claimed as aphrodisiacs. Okay, so a study in Boston a few years ago, 52% of men between the ages of 40 and 70 reported some degree of erectile dysfunction. And so, again, the hunt for an effective aphrodisiac, withdrawals in dopaminergic, adrenergic, and serotonin level agents has been intensively studied. So they can be classified really into 3 types. There's ones that increase libido, or potency, or sexual pleasure. And then the erectile dysfunction is really kind of a performance thing. Okay. So what are the causes of impotence, impotence? So it's actually can be a serious medical and social symptom. And so lack of desire or orgasmic difficulty, 10 to 52% of all men, and really 25 to 63% of all women. I used to teach that orgasmic dysfunction or inability to achieve orgasm was present in about 50% of women, so that half of women never had experienced an orgasm. And so the erectile dysfunction can be inability to achieve erection or maintain an erection sufficient for sexual intercourse and therefore procreation. I spent, probably saw in the Oklahoma Men's Clinic, probably 3,000 men, and not all of them were older men. Some of them were in their 20s, late 20s, early 30s. Pretty common in men past 40 as their testosterone declines. The problem is erectile dysfunction really is one of the first signs of potential impending heart disease later in life. So it's an important question to ask a man about erectile capability because it is kind of a harbinger of heart disease. So you kind of have to pay attention. And so associated with that is low testosterone. But testosterone does not work for all men for erectile dysfunction. Okay. The other underlying problem, or actually the main problem with erectile dysfunction, is blood flow and reduction in blood flow. Okay, so 50% of men that have diabetes have impotence. Atherosclerosis, 40% of men with erectile dysfunction, usually in men older than 50. And then common conditions associated with erectile dysfunctions is unregulated blood pressure that's high, lipid problems, although that's arguable based on what I told you last Wednesday, diabetes, and of course cigarette smoking. And then there's the endocrine disorders like low testosterone. There can also be thyroid difficulties, not rare in men, but way less common in men than women. And then, of course, pelvic trauma, broken pelvises, pelvic surgery, specifically prostatectomy for prostate cancer, bladder surgery, bowel operations, pelvic irradiation associated with cancer, direct trauma to the pelvis with vascular problems. And really, there's actually a penis artery bypass graft that can help with that. And then, of course, there's the other factors psychologically. There are anxiety, depression, stress. There's fear of sex, neurologic disorders, history of stroke, cerebral trauma, Parkinson's disease. And then there is a disease called Peyronie's where there's a calcium buildup in the penis, and they will get a curvature of the penis that makes it very difficult for them to achieve satisfactory intercourse. And then other organic causes, renal failure, liver failure, multiple sclerosis, Alzheimer's disease, sleep apnea, and chronic obstructive pulmonary disease, chronic alcohol abuse, and again, cigarette smoking. Okay, we could go through the entire thing of erectile dysfunction and how it works or what happens, but it basically is nitric oxide, and we've talked about nitric oxide. We did a whole class on nitric oxide, I think in May. And Viagra works to improve nitric oxide and actually blocks the reuptake of what nitric oxide triggers to get erectile tissue working. So basically, it's relaxation of the corpora cavernosa, which allows blood flow into the penis and creates erection. And then there's a valve at the base of the penis and the vein that needs to be working. So a lot of men will have difficulty maintaining, or they can get an erection, but they can't maintain it. And that is the reason for penis rings. So to kind of recreate that valve. Okay, so what are the herbals? And there's a whole bunch of them. Okay, so the first one we're going to talk about is Chlorophytum borevillianum. Villianum. See, there's Missouri, my Missouri accent. It's in the family of Liliaceae, and it is used to help with impotency, sterility, and to enhance male potency. Okay, so some of this is on rats, some of this is in men. But there's been improvement in sexual behavior. So they look at mounting frequency is one of the things they talk about, and latency between ejaculation. So how long does it take for a male or the poor rats that get picked on to be able to recreate an erection after ejaculation? So ejaculation frequency they looked at. So you're looking at, I'm looking at a study that was done on rats. And this is, of course, cited. All this stuff is cited. looking at the aphrodisiac and spermatogenic potential for chlorophytum, and I'm not going to destroy the last name again. But basically, the study observed a marked aphrodisiac action with increased sexual desire or arousal, sexual vigor, and then at the higher dose, the parameters of all sexual behavior were enhanced, but then got saturated at day 15. So after a 60-day treatment, the sperm count had increased significantly. So you kind of plateaued at day 14, these rats did. And basically, this was felt to be a useful herbal treatment for premature ejaculation and oligospermia. So oligospermia is low sperm count. Okay. Number 2, and I told you I'll make a list of these because you're not going to remember them. Neither do I. I have to be looking at them so I can pronounce them for one. Next one is Mondia whitei. Won't tell you what the family is because I can't pronounce it. But used traditionally medicine practitioners for management of ED, and it's used to increase libido and the management of low sperm count. So it's an extract, so you have to kind of look at the extract and how this is, and finding it. You can't find all these on the market per se, and I'll give you a list of some later on. Okay, Tribulus terrestris. It's a flowering plant. It's native to warm temperature and tropical regions. And so the investigation on this one was in young men. And it was found to increase levels of testosterone, luteinizing hormone, LH, which comes from the pituitary gland and stimulates sperm production and testosterone production. Also increases dehydroepiandrosterone, DHEA, we've talked about that, dihydrotestosterone, and DHEA sulfate, which is the blood level that we do. And this study, there was young males, and then this study in white rabbits. Okay, so there is an androgen releasing property of this extract, and that one is on the market. Like I said, I'll list them later, and I'll give you little links. I'm looking at a product right now that's based on that particular one. Next one is Crocus sativus, better known as saffron. This particular one was found to have no special benefits or no support of a beneficial effect of saffron administration in men with erectile dysfunction. Okay, so that one, they did a study on men, and they also did a study on rats, and followed all these parameters like mounting frequency, the ability for intromission, insertion of the penis, erection frequency, etc. No benefit. So the saffron plant, no help. Okay, Myristica fragrans. Okay, these are little seeds of basically the nutmeg family. And that is in a certain medical culture found to be of value in the management of male sexual disorders. And once again, this is, I believe, this is a mice study, so no rats this time. 50% ethanolic extract of nutmeg and clove, as well as penegra. So see, it's not that clear. They mixed 3 things together. And so they got some improvement in what they were looking at in these mice. So there's no human studies on this one. Next one is Phoenix dactylifera, which is date palm. And they were looking at sperm parameters and reproductive systems of rats. So this one actually improves sperm parameters. And the date palm has estradiol and flavonoid components with positive effects on sperm quality. So that one appears to help with sperm quality. Okay, and they actually did they did this one on male rats, no people. Okay, here's another one, Lepidium myenii, or maca, M-A-C-A. It's a cruciferous, and it grows, I believe, in the Andes mountains. So it's a kind of a mountainous plant. This one has pretty good science behind it. Okay, so the first study was done on mice. All those parameters got improved. So increased number of complete intromissions. They were able to count sperm counts out of the females after copulation. There was a 12-week double-blinded placebo-controlled randomized controlled clinical trial in which active treatment with different doses were compared with a placebo to test the hypothesis that maca had no effect or did have an effect on serum reproductive hormone levels in healthy men. So this is a human study. So when compared with placebo, there was no effect of maca on the hormone studies, no changes in hormones over time. Serum testosterone levels were not affected, and so the conclusion basically was there was no effect on reproductive hormone levels or serum testosterone. Okay, another study based on, it's a 12-week double-blind placebo-controlled randomized study. Improvement in sexual desire was observed with maca since 8 weeks of treatment. The serum testosterone and estradiol levels were not different, so that supports the other study. And there was an independent effect on sexual desire to 8 and 12 weeks of treatment with that. There was another one done on rat sexual behavior that actually made it worse in the rats. So the one human study showed an increase in sexual desire despite no changes in hormone levels. Okay, next one is Campharia, and this one's on the market. This one is on the market. There's a supplement for it. Probably doesn't help you at all. Campharia parviflora, Southeast Asian, traditionally used to enhance male sexual function, and not much scientific data in support of this anecdote. So basically no effect on reproductive organ weight after 5 weeks of treatment. Overall, not a whole lot of help from that one. Okay, this one is on the market, if I can say it. Uricoma longifolia, which is commonly called Tongkat Ali or Pasak Bumai, flowering plant. It's Indonesian, Malaysian, Thailand, Vietnam, Laos. In Malaysia, it's considered a symbol of a man's ego and strength because it increases virility and sexual prowess during sexual activities. So this one, dose-dependent, recurrent, and significant increases in episodes of penile reflexes, and then appears to show that there's an aphrodisiac potency in activity of animals. That's an animal. And then another study on rats. Transient increase in the percentage of male rats responding to the right choice based on an electrical thing. Had to do with rats that weren't interested in copulation. So showed a difference in behavior, in other words. So that one on the market, most of it's anecdotal. If you believe in rats and electrical stimulation studies, I guess you could try it, right? Can't even say this one, Satyresia kuzistanica. This is from the southern part of Iran. Appears to improve changes in plasma testosterone, sperm quality, spermatogenesis, which is creation of sperm, reduction in toxic stress, and reduction in DNA damage, which basically leads to the argument about free radicals and oxygen reactive species. But not a whole lot. This is all kind of, they did on animals. Although they had FSH and testosterone increases in those groups. And they also did cytology studies of the testicles and found that Sertoli cells were hypertrophic, meaning stimulated. This one you've heard of, Panax ginseng. This is kind of, Panax means all healing in Greek. So it is effective on nitric oxide. So remember, that's a neurotransmitter that induces penile erection. That's how Viagra kind of works. So the ginseng family has been studied quite a bit. And there may be some cardiovascular protection from ginseng as well because of the increase in nitric oxide. So nitric oxide is felt to be the reason that Panax ginseng has been used in traditional Chinese medicine for a long time for an aphrodisiac. Okay, yohimbe, we talked about yohimbe, pretty decent evidence on this one. Also present in Asia. It is listed, the only herb listed in the physician's desk reference for sexual function has been used for 75 years as an acceptable treatment for male erectile dysfunction, and the US FDA approved yohimbe as the first plant-derived drug for treating impotency in the late 1980s and was dubbed the herbal Viagra in February of 1999 in Europe. So it appears to stimulate blood flow by dilating blood vessels. So blood flow and erection are, if you don't have blood flow, you're going to have erectile dysfunction. And it also appears to increase the production of norepinephrine, which is essential in the formation of erections as well. So it can restore potency even in patients with diabetes and heart disease that are suffering from impotency due to those disease processes, and appears to stimulate the pelvic nerve ganglia and boost adrenaline supply to nerve endings. So that leads to an increase in sexual sensation and stamina. And even in men that don't have erectile dysfunction, yohimbe in some cases appears to increase sexual vigor and prolonged erections, longer erections. So see, here's a 20 milligram dose of yohimbine to 29 men with orgasmic dysfunction. And they were titrating the dose at home so they could go up and not have to produce an erection in a doctor's office or in a test setting, so at home. 16 of the 29 managed to reach orgasm and were able to ejaculate either during masturbation or sexual intercourse. A further 3 achieved orgasm but had to use a dilator. And so of the patients, 2 subsequently fathered children, 1 who had a set of twins. Another 3 were also basically cured. I hesitate to use the word cured anymore. So yohimbine's the deal. Phaedosia agrestis. So increasing blood testosterone concentrations, which seems to be the mechanism responsible for aphrodisiac effects. This study was done in male rats. So all the studies on that are in rats. Montanoa tomentosa uses a traditional remedy for sexual impairment. Another rat study. So, and couldn't find that one anyway. So I can keep going. Terminalia catapa. So there's, you think there's not any studies done on this, and again, a lot of these are done on rats, but some of them are mice or rabbits, but some of them are done on human beings. Okay, 1,500, so this Terminalia catapa, 1,500 milligrams per kilogram or 3,000 milligrams per kilogram orally for 7 days, marked improvement of aphrodisiac action and sexual vigor. However, the higher dose, those parameters of sexual behavior were inhibited, all except mounting frequency. Okay, and then there's 2 more. Casamaroa edulis. This is Central America and Asian aphrodisiac. Extraction of seeds. This is another rat study. And they did that study compared to Viagra, Both groups, significant increase in mounting frequency, intromission frequency, and first and second ejaculatory latencies. So Viagra produced a better activity as kind of expected, but it appears to be a similar mode of action with that one. Once again, rats. Ternera diffusa, this is a folk medicine aphrodisiac. Significantly reduced post-ejaculatory interval to next erection, and what appears to be the active extract compounds are caffeine, arbutin, and flavonoids. Okay, so that's kind of the list, and I told you I'll put it up later in the comments, so I'll put that list up, and then you can search around and look. I found some, I couldn't find others. On the trademark, well, yeah, I guess trademark. Yeah, most of them say TM. The two that I found that seem to be reviewed the best are Big RX oil, which contains epimedium, which is in that Latin name, there's an epimedium compound. And this one has ginkgo biloba, Asian red ginseng, there's some bark, hawthorn berry in that. That one's reviewed pretty well. It's a topical. You put it on the penis. And then there's another one called Maxoderm. That one has Panax ginseng and L-arginine in it. Virility pills, VPRX, that's a patch. It's got horny goat in it. Black pepper, ginger, yohimbe. Let's see what else. Stinging nettle. I don't know. I'm not sure that sounds great. Licorice. So licorice is one of the things that's on the aphrodisiac you can eat list. And then L-arginine in that one. There's Pro Enhance and there's virility patches. Okay, so those are the ones that if you can find them on Amazon. I'm sure you can find them in kind of any supplement store. A lot of these are on Walmart, I found. Okay, so from Life Extension, and you know I trust Life Extension. They've been doing this since 1980, so they're in their 40th year of really pharmaceutical grade supplements. Unfortunately, the ones that they have on Life Extension are not Life Extension products except for DHEA. So DHEA, of course, we talked about this from cholesterol and pregnenolone, can be converted to testosterone. So it's a way to improve testosterone levels, taking something over the counter that's basically a hormone. So triple maca, you remember we talked about maca, that is on Life Extension. That one didn't have very good reviews. One of the better ones was Tongkat Ali, A-L-I, Tongkatali. That one, geez, you know, it's 30 tablets for $21, so it's a 1-tablet dose. Tribulus, we just talked about. Tribulus, 450 milligrams, 60 capsules for $14. It's marketed for urinary health, but that has that particular herb in it. So does Tongkat Ali. And then horny goatweed, you've probably heard of as well. That one has, I'm going to let it load, epimedium in it. So a botanical use for centuries in China to support healthy sexual activity. So that's an extract that's standardized. It also has, no, it doesn't. A lot of people buy that with L-arginine, and we've talked about L-arginine. So that is basically the scoopage on herbal aphrodisiacs. So there are studies, most of them in rats, some in humans, not huge, like thousands and thousands of people. But there is a basis. So I'll put the list up. If you're considering anything from Supplement Superstore or GNC or wherever you're shopping for those kind of things, the one for testosterone enhancement probably ought to have DHEA in it. I of course, couldn't look at every product that's on the market, but DHEA is pretty, you know, the chemistry behind that is pretty good. So what we'll do is come up with something else fun to talk about on Wednesday. And I'm going to enjoy this fall day in Boonville, Missouri, while all the rest of you are cooking in Texas and New York City. But this is pretty cool. This is pretty nice weather today. So peace and health to you all. Have a great day. Have a great week, start of the week. And I'll talk to you Wednesday at 9:30. See ya. Bye.